integration is built on the fundamental principle that people need to be the center of both the planning and administration of human services. Clients' needs and expectations should be the primary consideration for planners, funders, and decision makers. Each year, OMSA presents local municipal champion awards to recognize the great work done by teams from amongst the CMSM and DSAB staff across the province. In 2011, there was a strong focus put on the community initiatives that are having great success demonstrating the principles of human services integration.
In 2002, 7 of our local special needs resourcing agencies that provide services to children in licensed childcare all came together to form a formal partnership. Prior to that, we all worked very independently of each other, and any relationships that existed were a result of professional relationships and not any formal relationships. So we came together and created a common vision, mission, and set of guiding principles that we use to lead our work. The vision is that all children and their families can participate in quality, inclusive early learning and childcare services. And that vision has actually held steadfast since 2002. The principles that direct our work with children and families put children and their families at the center of service, acknowledge their right to seamless service, acknowledge that parents are the key decision makers of their child and should be full partners in planning for their child, and acknowledge that all children who have special needs have the right to participate in quality inclusive programs.
SNAP is an acronym for Special Needs Access Point, and so whenever a early learning and childcare program or a parent or another professional has any kind of developmental concern about a child who is either already attending or maybe looking to attend an early learning and childcare program, they would call the SNAP coordinator to make a referral for services for that child. They would chat about what the concerns are, and from that information, the SNAP coordinator would then make a referral to the appropriate agency or agencies to help serve that child.
For the families, it's definitely less meeting time because we can all meet together. A lot of times then we can collaborate our meetings, meet in one central location, whether it be the child care center. So families aren't having to go to a meeting through, Family and Children's Services and then over at Kids Ability and then with their KW Hab representative. They can meet with the child care provider as well as all the consultants, and we can come up with a plan of action so that way the child's plan when they're here at the center can be implemented not only at home but here as well.
The partnership has become a very collaborative venture, and as a partnership we have developed guiding principles which we now apply to all of our work with children, families, early learning and child care programs, school boards, and other partners.
The partnership uses evaluations to gather information, particularly from families, around the types of services that we're providing and are they really effective? Is there a collaboration going on? Do families really feel that their voice is being heard? And are there a lot of barriers that we've created through old systems whereby parents are having to repeat their story several times? They may feel that they're not included as decisions are going forward. So we want to check all of those things out and see are parents really at the center of the work that we do, and it especially are the children.
I would not have known who to call or where to go about my son. I probably would have gone to my family doctor, first of all, if this had not been picked up on in preschool by the teacher. We very much felt important and valued, and like people were going out of their way for us. That's how we felt. It was easy for us, even though it was a difficult situation. It was emotional and it was sad at times, but there's so much support, more than I would have ever imagined. We met some wonderful people, and everything about it we highly, highly recommend, and we're so thankful it's available, and hope that everybody else knows it's there too, you know, so these kids can get the help they need.